If you're a nursing student and you're about to start doing head-to-toe assessments, here are some of the biggest things you need to remember. Point number one, when you're doing your nursing assessment, move systematically. You want to go from the top to the bottom. So you start with the scalp and the head, then you move to the eyes, you move to the ears. If you can find a way to just follow the way the body is already built, then you will not get confused. When you're assessing the eyes and you say perla, know what perla means, because the last thing you want is for your instructor to come ask you and you tell them, oh yeah, perla, and then they ask you what it means that you don't even know. Point number three, every body part that has two sides to it, or there's two of them, should be assessed for symmetry. When you listen to the lungs, assess for symmetry as well. Point number four, remember IPPA, so inspect, palpate, percuss, auscultate. The only time this doesn't apply is when you're assessing the abdomen. When assessing the abdomen, think IAPP, inspect, auscultate, percuss, palpate. And we palpate last because we do not want to touch something with our hands and move things around that will distort what we listen to. Point number five, when you're listening to the lungs, you know what abnormal lung sounds sound like. So, such as knowing that sounds like wheezing may be talking about bronchoconstriction related to conditions like asthma, or crackles is related to heart failure because there's accumulation of fluid. Point number six, when you're listening to the heart sounds, make sure that you know the correct route to go through. Ape to man, aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic is the only one that you're going to listen to on that right second intercostal space. The way to think about it is right to left, up to down. The mitral is the only one you're going to listen to at the mid-clavicular line. Point number seven, know what questions to ask in order to assess orientation. Your name, where you're at, maybe like the president, date of birth. Point number eight, the vital signs are part of your physical assessment. What is their oxygen level? And if they are on oxygen, must be part of your documentation. Point number nine, remember when you're assessing the skin, you want to look for any types of wounds. Get into the habit of measuring or learning to describe the wound. And finally, don't forget to scan the room. What do you see in the room? It kind of gives you cues into what the patient might be using as their everyday equipment. This is also going to help you as you develop into that wonderful nurse that I know you're going to be. Do me a favor and share this with another nursing student. Rock your next checkoff for head-to-toe assessments. I have faith in you. Bye-bye.